Good morning and welcome to our webinar, Tips for Leading a Successful Meeting. I'm Kim Waterman, Project Coordinator at the California Institute for Behavioral Health Solutions. Our speaker this morning is Amy McIlvaine, Project Manager for the Thriving in the New DMC Collaborative in LA County. Please note that all attendees this morning are in listen-only mode. We do encourage you, however, to submit your questions and comments at any time in the question section of your GoToWebinar control panel. If you pre-registered, you should have received by email a copy of today's meeting agenda template that Amy will be referencing in her presentation. If you didn't receive it, not to worry, you can download it now from the handout section of the GoToWebinar control panel. And the slides from today's presentation and the notes on the slides are also available there. There will be a brief survey at the end of this session, so we thank you in advance for providing your comments. We do take your feedback into consideration for future trainings and training topics. So thank you again for joining us, and I'll turn it over to Amy McIlvaine to begin our training.
Welcome. Thank you, Kim. How is the sound? I don't know. So far, I hope it's good. We are ready to start our presentation, and this, of course, is Leading Successful Meetings. And I like this slide, are you ready, and just sort of really taking a look at this empty meeting room, because one of the things you have to consider before you even decide to have a meeting is, do you really need to commit the time, energy, and resources to actually have people get together for a meeting? So that's sort of one of the first questions that we'll kind of review. But during the webinar today, we're going to talk about what I consider to be the 5 key areas for getting ready for a meeting. There's preparation, the invitation list, writing and creating the agenda, actually facilitating the meeting, and then finally closing out the meeting. And I will have to say that I feel sorry for anyone who attended the meetings that I facilitated in my 20s and 30s. I look back now and realize I wasted a lot of good energy and resources. I did not plan well all the time. I was really guilty of meeting creep, not being able to get everything done in the time allotted that I had set aside. And a lot of that, I think, was due to lack of preparation. I also sort of incorporated socialization into my meetings, and I realized actually someone pointed out, we were talking about how to develop really good meetings, and someone actually was talking about the idea that if you're going to socialize, you should have an event to socialize. That's like a potluck lunch, or maybe you sponsor a pizza day, and try and make sure that your meetings really stick to business, because it'll make it much more efficient and effective. And that sort of resonated with me. As I started getting invited to meetings, obviously I picked up other people's good tips. The template that I did include today was actually originated from the Franklin Covey planning series. It's a Stephen Covey template that I have over the years sort of adjusted and customized to make more sense. I also use it a lot when I go out and do training for when I was working with Niatex, because I think we do some change team meetings, and it was really important to document. So I just think it's a really good tool, and I would encourage you to use that if you are so inclined, if you like it. So as I mentioned earlier, we sort of have to think about what is the purpose of our meeting, and you need to think about who should be invited. But one of the other things we're just going to quickly cover is that there's lots of different types of meetings. One of the things that you might have in your organization, and something I used to do when I was leading teams of people, is we would have a morning huddle. And then we would also do another huddle at shift change. And those were really casual meetings. They were always started at the same time each day. If you couldn't make the huddle because you had a customer who needed some help, or a patient crisis, or something unexpected happened, it was your responsibility to find out what happened at the huddle, but it was appropriate that not maybe everybody could attend. Those meetings were, as I mentioned, usually we gathered, we stood up, we didn't sit down, and there was usually a pretty concrete sort of a checklist of what it was that we talked about, and I think that is probably something that you are probably taking care of in your organization too. There's also a one-on-one meeting, which could be impromptu, because sometimes it takes a little less planning or organization, and we want to make sure that we're available to talk with people on a one-on-one basis. But there's also times when we might need to plan that out also, like, for instance, a performance appraisal. We sometimes hold large meetings where we have to bring our entire staff together. That might be a quarterly meeting or a year-end review. And often I think probably what happens is that we have departmental meetings, and those may be something that we schedule on a reoccurring basis. We also have to consider that you have board meetings, you might do community outreach. I'm going to talk a little bit more, about all of these different kinds of meetings, but the template that I put out can actually be kind of customized to meet any of those needs. The first thing you have to think about is really, what is your objective for the meeting? And this, I think, is the clearest and best way of making sure that your meeting doesn't creep into what I consider sometimes this big, huge, giant monster. You start bringing up all sorts of things that maybe aren't even critical to the reason that you're meeting in the first place. Here's an example of a meeting objective, and what I kind of mean by what is a meeting objective. You can see that it's pretty simple. I said at our last meeting, I'd like to frame, how is this meeting a part of something that we've already done? So you could say at our last meeting, we made the decision to improve our treatment planning and documentation process. By the end of this meeting, we will define next steps to improve the following. And so we're going to work on charting using patient voice, because this is a clinical meeting, a unit meeting. We're going to learn how to identify and write clear, concise patient goals and think about ways that we can improve that process. And also talk a little bit about improving timeliness of the submission of our documentation for our patient treatment files. So that may seem a little bit lofty at first. This actually was one of the things that I really didn't usually incorporate into my meetings, but I learned this probably within the last 8 years, that having this clear objective is really a way of helping people in the meeting stay organized. You'll also notice that as we go into the invitation list, it also gives you an idea who needs to be at that meeting. So it's a really great I think it's a really critical and probably the most important aspect of the preparation. Here's another meeting objective, and this is basically, often some of our meetings are just like I said before, reoccurring. So it might be a monthly finance oversight meeting, and when you go to those are the 4 particular things that you do. You look at a budget review for the previous month, then you look at the projection for the next quarter, and problem solve discrepancies. And always, you'll notice you assign some action items. So that might be something you would adopt for one of your regular occurring meetings. And I mentioned before, sometimes who needs to be there? Oftentimes, if you talk with your staff, they'll be the ones who will be able to tell you whether or not they think they should be there, or maybe they don't need to be there. And it doesn't hurt to kind of check in to make sure that the meetings are really meaningful and that the people who are attending really need to be there. So we have to be, again, thinking about that objective, really kind of think about who should attend our meetings. And I'm going to go into that a little bit more in more detail. So, and this too, I think when you start thinking about, is the meeting really this complicated? But again, this isn't probably something you're going to have to think about and worry about a lot, especially not with a reoccurring meeting. But for instance, with the transition for the implementation of the DMC waiver, I think that I know that I use this tool when I'm thinking about who needs to be involved in the meetings that I'm having now, because what is the depth and breadth of the impact? So you'll notice on the left side, we're looking at people who might be able to influence the particular topic or have some sort of information that maybe at the local or at your unit level you don't have. Or you may think, well, we're going to have a meeting with our clinical staff and our counselors. But if you start to really think about some of the implications of some of the implementation, you might start to think about, we really need to have somebody who is in charge of quality improvement, or maybe the CEO needs to be at this meeting because we're going to have to make some decisions and we might not have that authority. You also want to think about the interest and support for that idea that you're having. Sometimes it's nice to get a fresh perspective. So I like this little, I guess I call it a sheet of paper with 4 squares or 4 rectangles. because you want to think about these categories. Who do you really need to keep satisfied, and who do you need to kind of keep in the know? Who might be monitoring? For instance, if we were talking about making sure that we were submitting our paperwork in a timely fashion, again, it might impact the accounting department or the billing department. So maybe since they have to monitor that process, maybe you'd like to invite them into the meeting when you were thinking about how you could improve processes. And then again, are there people that you just need to keep informed? Is your executive director interested in hearing some of the new policies and practices you're putting in place? Or perhaps your board is interested in hearing some of that information. So think about, who else needs to be informed? Often, like for instance, if we would go to the SAPC monthly, all mandatory meetings, I would see some executives and maybe leadership, but then those leaders had to go back into their organization and probably really think through something like this picture here about, wow, who else needs to know about those great things that I just learned? And so again, I just think sometimes it's just a nice way of looking at something, making it look a little simple, but also kind of reframing what we might already know. Then again, when you start thinking about who needs to be involved, I like this diagram. It starts out, up here at the top, we're talking about our external stakeholders. And those folks are usually patients. It could be your patients. It could be community members, referral sources, payers, and policymakers. You probably even have some other ideas about who external stakeholders that you might be inviting to your meeting. And we can make this interactive. If you have any ideas as I'm saying anything, or if anything resonates with you, or you have a good idea, as Kim mentioned, we do have the little drop-down menu, and there is a question section. On my computer, it's over on the right-hand side, so hopefully it is for you too. If you have any great ideas, feel free to pop those into that questions box while I'm doing this presentation. We'll type up those notes and also disseminate those so we have even more input than just some of my ideas. And so the second one is really, when do you invite the whole organization to something? And I think that's one of the ones that's really hard to get everybody in the room at the same time. But I also feel it's pretty critical. So I would say at a minimum, you want to make sure that you get your whole organization together on an annual basis, and maybe even consider doing it quarterly. And that you do have to think about including all your departments, your full-time as well as your part-time staff. And it might even be appropriate to have your contractors, especially in some cases you have your medical director. So kind of scheduling that, making sure that those people can attend is really important. And it takes a little more time and energy and planning to get that done. At the organization or unit level, again, I think for sure I go out and I visit sites, and I know that clinical teams meet very regularly. I think we're going to see more people meeting to talk about finances, and I know that probably people in business operations have been meeting more frequently because of the implementation and really looking at workflows. Some of you also have security that may need to be engaged and have regular meetings. And then, of course, board meetings. And again, there's probably other, but you'll notice that we go from really large to we're getting smaller and smaller. And that will also kind of determine, logistics, which we're going to cover later too. And then finally, it's the people who are really responsible for solution delivery. So for instance, again, if we were looking at my previous objective and we were sort of talking about, improving our notes and making it patient-centered, at some point we really need to make sure that we have time for the counselors to be able to sit in a meeting and listen to what's going on. It might be directed, facilitated, or part of the training might happen with from the LPHA. You might also want to consider whether or not the reception staff needs to be there, so they have a real clear understanding of where your program is going, and they have the information they need in order to respond to customers who either walk up to the front desk or maybe call your organization. And I think we're going to see more and more that our case managers are going to be part of these smaller solution delivery groups. Whoops, That's not the button I wanted. Okay, I'm just going to take a quick pause. Kim, are there any questions right now that I need to respond to, or?
Not at the moment.
All right, great. So far, it's sort of been me being a talking head. But again, if you do have ideas or questions, please feel free. Because again, I mentioned that, well, I don't know if I was real specific about this. My attention to holding meetings, and let's just put it this way, I'm not done. I feel like I can always make some improvements. So if other people have ideas, feel free to send them my way, because I'm always interested in seeing what other people do to make fabulous meetings. So the next thing is really this agenda, and that too is, I think of that as a cornerstone. You have your objective, then you have to kind of think about the agenda. And you want to think about who you wanted to invite, and so you might make sure that those folks are involved and have a key area, and they can actually maybe present at the meeting. I'm also I like to try and make sure that there isn't just one person who gets to talk. Some meetings, they're more, just perfunctory. We're just going to cover this list. We're going to do a quick check-in, and maybe it feels sort of like a facilitator asking questions of the group. But oftentimes you're going to come to a meeting and you'll assign other people a small part of the meeting to do a presentation or report on a finding. And so you want to make sure that when you sit down, you think about what those objectives are, and then you have to, I really like to just make a line item like this and say, what is the agenda item that we're going to cover? Who is going to be the person who's going to do the presentation or talk about it? And then how much time is allotted? Because again, when you sit down and think about this, many times I've gone and I've broken it down like this in these agenda items, and I thought, ooh, it really will shift my time. I may not need as much time as I thought I would to have people come, and so I will shorten the meeting. Or I might look at it and go, wow, we can't possibly cover this in a meeting. Should I see if I can get people to stay longer, or do I need to break this up into 2 separate meetings? And so I find that, again, the agenda items are sometimes the heart of the meeting too. And here's some quick tips for facilitation. And again, if you're not comfortable with facilitating, it's always great to practice. And I also want to make sure that people understand that it's nice to delegate facilitating meetings, because it is a professional development skill, and it's a nice thing. So having more people in your organization that can lead a really good meeting is actually a benefit. So we talked a little bit about who's attending the meetings and who do you invite. You can kind of quickly look through here, and you'll notice a couple things that might be a little bit different. And you don't necessarily have to say if it was a business manager or a case manager, especially if it's primarily people in your own organization. I did this just for clarity, so you would kind of have an understanding of how I'm putting this meeting together. But you will notice that I invited David Frey, who is from Target, because we were going to talk about being patient-centered, and I wanted to invite someone from outside the field to talk a little bit about how they run their customer service at the Target store. And we also invited Ming Lee, who is a clinical director at the Worm and Fuzzy House, to talk to us about ideas, because sometimes when we hear things from someone else, we can be a little bit more creative. It helps us kind of break out of our own box. And this is attendee, I call it attendee or describe, it's the subject matter expert, and that's how I kind of wrote that down and then talked to you about, showed you that I invited this person from Target. The other thing I do is assign these key meeting roles. I'd like to know who's going to facilitate the meeting, and again, it doesn't always have to be the same person. It doesn't have to even be one of the leadership. It could be anyone who's attending the meeting. And if it's a reoccurring meeting, again, I highly recommend that you share this responsibility. Takes the heat off of one person doing it all the time. It also gives other opportunities for other people to have a stronger voice. I look at somebody to do scribing. I do try to get notes taken at the meeting, even if you don't distribute them. It's a great thing to have for your own knowledge when you're planning your next meeting, because you may not remember what you went over. It's also a good thing to have the meeting notes because you can catch up the people who may not attend the meeting. I like to have somebody who takes data. I like to make decisions with a clear set of data. So having someone there who's, having someone there who is really in tune with this idea of collecting data to make decisions is really an important thing. And I also have a timekeeper, and this is the one I just learned 8 years ago. It was at NIATEX when we would get together for team meetings. They literally had one of those kitchen timers, and looking at the agenda, there would be someone that would set the timer. So when it was someone's turn to do a presentation, they got their 10 minutes, and that was it. At first, to me, I was like, whew, this does not seem friendly. This is really daunting, but I really got to appreciate it after a while because I think we've all been in meetings where someone is supposed to take 10 minutes on the agenda and it starts to get to 15 and then it creeps into 20, and those other folks that were supposed to be a part of the meeting may start to see that they came prepared to do something and there may not even be time on the agenda, and that sort of ends up having that person not feel as perhaps their topic or their ideas were as respected as someone else's. So when the timer goes off at the NIATEX meetings, the group just makes a decision. Is this a topic that is important and we need to have further discussion? And then let's determine which of these other items on the agenda we're not going to get to, and we'll plan those ahead for our next meeting. Or it may be such a good topic with so much conversation that we actually would say, this is a meeting in and of itself. Let's do this. Let's talk more about this at our meeting next time. And so the whole meeting would just be on that particular topic. And after people really got to, get into the groove of this timekeeper, it didn't feel daunting, and everybody really liked it. So you might want to consider that. I often go around, I have a little timer now that looks like a ladybug. And I throw that in my bag a lot when I'm doing meetings because I, too, have a problem sometimes with my own personal meeting creep. So that is the tips on that, and I am just constantly not using my mouse correctly. Sorry about that. Good thing I'm not showing you other things on my desktop. All right, and then the next thing is really just, now we get to logistics, and I will say this is another thing. I used to start out with, I'm going to meet in clinical, we're going to have a meeting on clinical practice and process. I'd pick the date, the start and end time, without really going and thinking about how much time do I really need. So now I actually build this page in, you can see much later in the process than I used to. And I do give it a clear title, especially if it's a reoccurring meeting, then it's easy for people to recognize and understand. I also like to identify the day of the week and the calendar. And again, this might happen more if you're inviting external people. I think sometimes it's easier for us to commit to a date and time if we know the day of the week. I'm big on start and end time. And I also want to make sure that I include location. And again, remember, I invited some people from outside the organization. So I would include Whittier House. I would say that it was the dining room. And I would also include the address and the zip code if they had to get in with a Google map. And you might think some people may be joining by webinar or phone. So make sure that you have that clearly indicated, because I find at the last minute, a lot of people are scurrying around. They may have the agenda with them, but they may not remember what that webinar is or that phone number. And you'll notice that Kim sent us out a reminder for this email, and all of that information was included again. Having a reminder to actually make sure that people come to meetings, especially if you have people who notoriously sort of don't show for meetings, you might want to consider sending out a reminder. That works really, really well. And I'm just going to talk a little bit more about the start and end time. This is really another essential that sometimes appears really simple on the surface, but think about how many meetings you've been to where you're waiting for someone to show up, and while you're waiting, you might start really having some conversations with people about anything under the sun. It may not even be meeting related. What's happening during that meeting then is that those people that are already there are starting to build a rapport. So they've already sort of set the stage for being comfortable at the meeting. The latecomer comes in, and we often sometimes then have to catch them up. And that's a great way to lose the people who actually showed up on time. So it's more than just a respect issue to be on time. It really does kind of throw off the rapport building that occurs, and it also sort of will bore those people who have to wait for the catch-up to tears. So I highly suggest that you start holding people accountable for start times. And what I do is just get started. And then if people come in late, we would expect that they would sit pretty quietly, and at the end of the meeting, they could get caught up verbally, maybe pull someone off to the side, the facilitator, and or again, if you're taking good meeting notes, you can just have that person read those notes. And ending on time is important also because many times being late for a meeting cascades into some havoc later in the day. Another big thing to think about is if you're having a long meeting, include break times, make sure those are purposeful, and set a policy for phones and common disruptions, because that's really another thing that's sort of one of the things that can be it's annoying for many, many people. And then we have our wrap-up and we schedule our next meeting. I'm a big believer too if it's a reoccurring meeting. If it's not a reoccurring and already on the calendar, try and get people who are in the room to commit to the next date. And then just ask these 3 questions. Were the right people there? Did we accomplish what we attended? And what could we do to improve the meeting? Because out of that discussion, you'll get some of your own really great tips that relate very purposefully to your team and your staff. And as Kim mentioned, these slides are available in the right-hand side of your screen, and they will also be sent to anyone who signed up for our webinar. And that's it. Good luck. I hope you learned a tip or 2 to get a thumbs up from people who attend your meetings. Thank you. And we have like maybe 3 minutes if anybody has any questions, but I'm not thinking there's probably too many. But Kim?
I don't see any questions at the moment, but we do have a post-webinar survey. If you could just complete the 3 questions for us with any future webinar topic ideas and let us know what you thought of today's webinar. So thank you, Amy, for your presentation, and thank you to everyone in the audience for joining us. With that, we will conclude our broadcast. Have a great day.
Thank you.